Allison Montague is a 17-year-old student who sustained an uncomplicated lateral malleolus fracture in a soccer game. She was carried off the field and brought to the local emergency room after her injury. In the emergency department, an x-ray was taken and the fracture was identified. She was casted in the emergency room and sent home. It is now 3 days after her visit to the emergency room.
Hi, Allison. I haven't seen you in a while. How's your year going?
It's been okay.
Yeah, how's school?
Pretty good. I mean, I'm taking a couple classes that I like.
Okay, that's terrific. And are you still playing soccer?
I am. That's why I'm actually here today.
Yeah, I see. Tell me what happened to your foot.
So I was playing this game against Westville. It was our big game, and I'm so mad at my coach. He put me on his defense, and I never play defense. And so this girl from the other team, she comes up to shoot, and she steps on my foot and then trips over my foot, and then I trip over her.
That sounds like a big mess.
It was a pretty big mess.
Well, so what happened?
So I went to the emergency department. They took x-rays of my foot and they said that it's fractured, and so they sent me home with these crutches.
And did they give you any other instructions?
They told me to ice it and that I could take Advil if I wanted to for the pain.
And how's that going?
I guess it's okay. I mean, it still really, really hurts though.
Okay, and have you been back to school?
Yeah, I mean, it's okay during the day. I have a friend carrying my backpack between classes, but it's painful when I go in between the different classes.
Yeah, I imagine. And are you
Able to elevate your foot while you're at school?
The desks in my classroom, they're all connected, so like the desk part is connected to the seat, and so I'd have to pull over another desk, and it's just really awkward, and
Yeah.
I don't really want to draw too much attention to it while I'm in class.
And how about ice? Can you do that between periods?
I mean, I'm pretty bad about it. It's just like not,
Okay.
it's really cold and.
Okay. And so, but it's more or less okay when you're in class, and then between classes, and it sounds like at the end of the day, it's giving you some trouble.
Yeah, I mean, I guess when I really stop and think about it is when it really hurts me at the end of the day, you know, because like when I'm in class, I'm like paying attention to class and I'm not thinking about my foot as much, so.
Right. Right. Okay, well, why don't we take a look at it?
On physical examination, the cast does not appear overly tight. The toes and nail beds are pink. The toes are warm and well perfused with brisk capillary refill, and the toes have normal movement and sensation.
So, Allison, before we finish up, I want to ask you a couple of questions that I ask all of my patients.
Sure.
In the past year, how many times have you had a drink with alcohol in it?
I guess maybe like once a month.
And when your friends drink, about how many drinks will they have?
Probably like the same as me, like a beer or two.
Have you used marijuana or any other drugs?
No.
Have you ever taken anyone's prescription medication for any reason?
No.
Using the Kraft screening questions as a guide, Allison gave the following answers. In Part A, she answered, "Did you drink alcohol in the past 12 months?" She answered yes. "Did you smoke any marijuana or hashish?" No. "Did you use anything else to get high?" She answered no. When moving on to the questions in Part B, she answered that she had not driven in a car by someone who was high. She did not use drugs to relax. She did not use them when she was alone. She did not forget things while she was using alcohol or drugs. Her friends or family had not commented or asked her to decrease her drug or drinking use, and she had not been in trouble. Using Allison's answers to the Kraft screening tool and the triage guide, how would you estimate her risk for drug abuse?
Okay, well, for the sake of your health, as your physician, I'm going to recommend that you don't drink at all.
Okay, yeah.
Let's now think about what we're going to do for your foot. So, how would you rate the pain on a scale of 1 to 10 at the end of the day?
I mean, it's pretty bad. I would say maybe like a 7.
Okay, so it really gets it really gets pretty painful. Okay, so I think what we're going to do is I'm going to write you a prescription for pain medication. You
Okay.
can take 1 or 2 pills up to every 4 hours as needed. I'm going to give you a 2-day supply, but only take it when you're really having a lot of pain, okay?
Sure.
This medicine has some Tylenol mixed in it, so don't take any other additional Tylenol. But if you want to keep taking the ibuprofen, that's a good idea, okay? I think that that'll still help you.
Okay.
I really want you to raise the foot as often as you possibly can. I understand that it's really tricky in school, but if there's some way that you can do it, I think it's going to make it get better a lot faster.
All right, I'll try.
Okay, and also I want you to remember that the ice is also really important. It's going to help that swelling go away. Okay, I think the pain should be getting better pretty much every day. I think after 2 days, you shouldn't really need the pain medication anymore. And if you're not really much better in 3 or 4 days, I'd like you to call and come back and see me again.
All right.
Okay? So Allison, before we go on, I want to ask you a couple of questions that I ask all of my patients.
Okay.
In the past year, how many times have you had a drink with alcohol in it?
I guess like twice a month.
Okay, and when your friends drink, about how many drinks will they have?
Maybe like 3, 4, I guess.
Okay, and have you used marijuana or any other drugs?
No.
Have you taken anybody else's prescription medication for any reason?
So a friend of mine the other day, he noticed that I was in a lot of pain, and he told me where I could get a Percocet. And I was actually wondering, since that seemed to help so much, is there any way sort of that you could prescribe that to me so I don't have to like go through my friend?
Again, using the Kraft screening tool as a guide, in part A, Allison answered yes. In the past 12 months, she drank alcohol. Did you smoke any marijuana or hashish? No. The third question, did you use anything else to get high? Although there may be some room for debate on this point, Allison's intent seemed to be pain relief rather than euphoria, and thus no seems the appropriate response to question number 3. But in the questions that follow in part B of the Kraft screening tool, she answered the following. Number 1, have you ever ridden in a car by someone who was high? Yes. 2, do you ever use alcohol or drugs to relax? She answered yes. Do you ever use alcohol or drugs while you're by yourself or alone? She answered no. Do you ever forget things you did while you were using drugs or alcohol? She answered yes. Do your family or friends ever tell you you should cut down? She said no. And lastly, have you ever gotten into trouble while you were using drugs or alcohol? And she answered no. Using Allison's answers to the Kraft screening tool and the triage guide, how would you estimate her risk for drug abuse?
Well, you know, I certainly don't recommend that you get Percocet from somebody else. In fact, I don't recommend that you take any medication that's not prescribed to you at all.
Yeah, I know. It was just the one time, and it really helped a lot.
Right. I know that they can really hurt a lot, but I want to talk about ways that we can really maximize the pain control without using a narcotic, because they have so many side effects, including the potential really for becoming addicted to them.
Like, I've literally done everything that they told me to do in the emergency room, and like nothing is helping it. You know, the Percocet was pretty much the only thing that I took that made it bearable.
Right, right. No, I know these injuries can be really painful. I just want to go over the instructions again. So for one thing, I'd like you to take 600 milligrams of ibuprofen every 6 hours, okay, whether you're feeling pain or not, because that'll help with the inflammation and that'll help it get better faster. You can also add some Tylenol, and particularly right around bedtime, because it seems like that's when you're having the most trouble. So adding a dose of Tylenol right around then to really help so that it's least painful when you're trying to go to sleep. The other thing is that I know that it's going to be really challenging at school, but you know, if we can get your foot elevated more and if we can get the ice on it a couple of times a day, I do think that that's going to help it get better much faster. So I'm wondering if you could talk to the school nurse or maybe some of the teachers about how we can make that happen.
Yeah, you know, I already take, actually, you know, like sometimes when I'm
playing soccer and I just hurt myself regularly, I take, you know, Advil, like maybe like 4 of them, and that's what I take for like a normal injury.
Right.
And I've been taking, you know, I've been taking that since I came home, and it's really like, it's like I can't even sleep at night.
Right. No, I hear you that it's really painful, and I think it's going to take a couple of days. I mean, I wish there was some way that we could really make it get heal quicker, but I really don't want you to rush it. Your body needs time to heal. That pain is telling you that you're not ready to get back on the field yet. But it should be getting a little bit better every day, and it really should be much, much better in 3 or 4 days. And if it's not, I'd actually like you to come back to the office, and I'd like to take a look at it again.
I mean, I just don't understand if the Percocet definitely helped me, like why I can't take that again.
Well, I hear ya. I'm sure that the Percocet took away some of the pain, but I'm also concerned about the side effects that people can get with Percocet. So some of them you've probably heard of, you know, constipation and nausea, but they also can be quite addictive, and so that's what we'd like to avoid here.
I mean, I really don't understand. I mean, it's not like I already told you that I don't do any drugs, you know?
Right, well, I'm glad to hear that. I think that's really a smart decision. At this point, I think you really need to let the foot get better on its own. I know it's going to be painful for a little bit. That's just how these injuries are. But again, if it's not healing as expected, I really want to take a look at it again.
Is it possible that like when I come back, if it's still bothering me, that you would write me a prescription then?
Well, you know, I think let's take it one day at a time. If it's really getting worse, or if it's not better in about 3 to 5 days, I think we need to take a look and make sure that there's nothing else going on.
Okay.